Okay, so I think we're on 12:30. So hello and welcome to day 2 of the NQI Can Lunch and Learns as part of Clinical Audit Awareness Week 24. So my name's Vicky Patel, the chair of NQI Can and Clinical Effectiveness Manager at the Rotherham NHS Foundation Trust. Your chair for today's Lunch and Learn alongside Marina, who's our General Secretary as well, that you can see on the screen. So the theme today is patient and public involvement. So this is around how we can actually utilise clinical audit to effectively involve and engage our patients, our service users and the public in how we're actually improving health and care. The event is being recorded. It would be lovely to see your cameras on. You can see that the chat function is live, so we do ask you to remain muted to allow less noise for our speakers in the recording, but please do get posting into the chat function and we'll keep an eye on making sure that we're responding to anything that you're putting in as we go through the lunch and learn. So if we move on to the next slide, we'll be able to see that we've got a programme of lunch and learns for the whole week. Lovely, thank you. So yesterday we held that patient safety lunch and learn. We heard from Rachel Paul, the head of patient safety implementation at NHS England. And today we're talking all things PPI, and we've got Kim Rezel, who's the head of our patient and care engagement at HQIP, with some of the service user network members talking to us today. You can see as we move through week, tomorrow we've got Dr. Charlotte Richardson from NHS England and Danny Keenan from HQIP looking at addressing health inequalities. And yesterday HQIP published Danny's blog around health inequalities, so we'll pop the link to that in the chat for you if you've not read that. On Thursday, we're excited to welcome back Sam Riley, Director of Making Data Count at NHS England, to support us all in effectively influencing change. And then as we round up the week on Friday, it's really thinking about the impact that clinical audit does have on improving health and care. And Zoe Lord from NHS Horizons will look at how we ensure change is actually sustained over time to really make sure that we're future-proofing health and care. We know the population are and will be living for longer, and it's how we support our local communities to live healthier for longer as well. So if we move on to the next slide, then we'll be able to see today's agenda. So we've explained that we've got Kim and our Sun members with us today, and we'll hand over shortly. We're also going to hear the winner of the Clinical Audit Hero Awards for PPI, and they're going to present their winning project as well. There will be the opportunity to ask questions, but we do also encourage you to post them in the chat because we can be responding to those as well as we go through the lunch and learn. If we don't cover all the questions, we will collate them and publish a Q&A alongside the slide pack and the recording so that you can share this widely within your organisations, but also you can access it again for yourself. So we always love to hear from you. So at the end, we will be running an evaluation in the last 5 minutes. So do please stay with us and let us know your thoughts. So just moving to the next slide then, please. It's just opportunity again at this point before we move into the session to really just explain that obviously to NQI Can, it's our clinical audit community and our wider QI community, that this week really is that opportunity to shine a light really on the impact that clinical audit can have on improving health and care. So we touched on this briefly yesterday, but just highlighting again today, NQI Can's got its 10 regional networks. We're going to pop some links and contacts into the chat. So if you're not yet a member of your regional network, you could request to join. The networks are actively involved in delivering on NQI Can's forward plan and our improvement priorities. They take that voice from all your health organisations into the national network, and again, they take that voice from the network back out to the regions. Hold the quarterly meetings. Next one's 24th of September at 10 AM, and our web pages do actually host the live links for you to join those with us. So just briefly sharing again here today the Future NHS platform. So NQI Can has a network and sharing forum for us to network with our peers. And as of this week, we have moved that across to the Future NHS platform. So if you already were a member of the forum, you should be receiving an invite to join. But anybody that wasn't and wants to join, we'll pop the link in the chat and you can head on over to Futures and just put a request in to join that workspace. We've also got the National Clinical Audit Knowledge and Learning Hub on there as well. So the beauty of moving the forum across means that you can log in for the day to the Futures platform, and you can seamlessly move between all the workspaces that you are a member of. So the NQICAN platform, that workspace, very much around a lot of that local clinical audit that we're doing within our organisations and across our systems. And then we've also got the National Clinical Audit workspace, where we can directly link and liaise with the National Clinical Audit providers and our peers as well, to really take that action on our National Clinical Audit data. So the week's touching on all of the 5 themes, and we're going to touch on key points, hear from our key speakers, and set you with further challenges. So very quickly on the next 2 slides before I hand over to Kim, you can see what we challenged you with last year in terms of going back to your organisations and thinking about what we shared with you in the Lunch and Learn around looking at your clinical audit strategies, your policies, and making sure that they do align with your patient and public engagement strategies and policies and the processes that you've got locally for bringing that voice into any improvement work that we're doing. So we want to know how you've got on. So please do get posted in the chat as to what you've managed to do over the last 12 months, maybe what you're still finding a challenge and actually you want to reach out to your peers for a bit of support for. But please do register on that Futures platform, because we want to see some of these discussions carry on that peer support workspace, so that it's not just 1 week in time. We're actually taking this forward in every day in the work that we're doing. So on the next slide this year, we really want to be challenging you to think about some of these questions here as we're starting to hear from Kim and the Sun members, and then obviously as we hear from our presenter later on as well, in terms of actually when we go back today to our day jobs, starting to think about actually those open and honest conversations that we are having, and actually are we holding them and holding them in the right way, so that we do actually get across. We're working in collaboration really with our patients and service users so that they are feeling informed and involved. We've got that shared decision making going on, and that actually we're then listening and getting that feedback from our patients and service users so that we know we're actually getting it right. And this is where our measurement comes in, but actually we need to involve them in part of that measurement. So it is actually finding out what matters to them, what should we be measuring, and actually when we've got those results and we've got those outcomes, which are the important ones that we need to prioritise that improvement on, and actually let's get them involved to help us take that forward so that we do that in the right way. And actually when we're measuring for that impact that improvement's had, let's also measure the perspective of the patients and the public. Actually we feel it's had an impact and improved, but actually do they? So it's just setting the scene and giving you a little bit of food for thought really, so that you can now listen to what Kim and our Sun members are going to share with us today. So I will hand over to Kim now, and I think Kim, you're going to take over screen sharing.
I am. I'm just wondering if I could see if Wendy, Mike or Sarah are with us today. Do let me know, but I'll start sharing slides. Okay. Oh, hang on a minute.
Morning, Kim. It's Wendy here.
Oh, lovely. Thanks, Wendy. Okay, I'm going to do it again because I need to include sound. Real test today because I'm sharing a video. Okay, from the beginning. Can you see that, Vicky?
We can, Kim, yes.
Brilliant. Thank you. Thank you so much for inviting me here today. It's a real pleasure and so good to see so many people have joined this session. Today is all about patient and public involvement. I'm just really grateful to be here and pleased to highlight this important area of our work. I'm Kim Rosell. I'm the head of patient and carer engagement at HQIP. And today we also have some of our service user network members. So we've definitely got Wendy. Hopefully we've got Mike and Sarah as well. Do give a shout if you're around. Okay, next slide. There we go. Okay, so today I'm going to talk about our Sun members. We have a video, fingers crossed, that we're going to share with you. And then I've got a couple of slides as well, which will talk about what the project is about and its outcomes. Wendy's going to talk through how we work together, and then we'll look at what's next for the project. So for those that don't know, just a couple of bits of information about who we are at Healthcare Quality Improvement Partnership. Our core bit of work is funded by NHS England and also the Welsh Government, devolved nations and Crown dependencies, depending on the project. And we commission the CAAW, which is the National Clinical Audit Patient Outcomes Programme. And as part of that programme, we cover all these different areas of care. Some are clinical audit and some are outcome review programmes. You see a wide variety there. But my focus today is about our service user network, who we call SUN. You may have seen me speak before about our SUN, previously a small group. At its peak, it's about 40 members who we met with quarterly, and they advised on projects and aspects at HQIP. But as a group with me, we were noticing the need for change. The pandemic had moved us all online, the numbers were dwindling, with only about 20 active members and about half that joining those meetings. And the group was feeling quite stagnant, and we wanted to see more movement, flexibility and diversity of membership. So as a group, we talked through options and wrote up recommendations for change. And by the end of 2022, we changed how we facilitated and worked with this group. We implemented a new sign-up process and removed some of those more onerous activities like the regular meetings and the need to commit to those. So people sign up through the website, completing a form which enables me to confidentially see certain demographic information, which helps with data, but also to match people's interest and lived experience with our projects. So obviously this allows for more diversity, and we can ensure a good mix of representation with the work. So some examples, we can ensure we have people from different areas of the country, different ethnicities or different ages, and certain experiences are represented. So we can target information, target invitations for involvement, for example, if we were looking at a maternity project. And at the moment, what we're doing is sending newsletters every 2 to 3 months, which shares opportunities for involvement in various HQIP activities, but also from CAAW providers and local projects. If you want to share some information and invite some members to participate, please get in touch. So some examples include in this year's Audit Heroes Awards. We've got some members involved in the judging panels for each category. They're involved when we commission for those CAAW projects. So as HQIP develops the specification for each of those projects, we run focus groups for people with lived experience. And just in the past few weeks, we've done that with perioperative care and MSK. Also, we're running the PPI element of the National Obesity Audit. So we've set up a user panel of 20 diverse members from all over the country who have shared their stories about the care and treatment that has been available to them or loved ones, and they continue to influence the direction of that project. We also have some members in the independent advisory groups for our outcome review programmes. And recent projects, I mentioned maternity earlier because we ran a maternity project a few months ago in which we engaged with diverse disadvantaged communities to hear about the experience of maternity care. So we approached some members and some members, but we also went wider into smaller organisations and charities to reach really disadvantaged communities. And in January, we held a focus group with some members to ask their views on some recent CAAW infographics. And next week, we are holding a focus group with SUN about how data is shared within CAAW, but also for extended purposes through our data access request group. But today, I want to focus on one project. So Health Data Research UK were funding organisations to help them meet the transparency standards. And our project was to improve the transparency of how HQIP shares data, and we focused on co-production as a way to deliver impact and insight for this project. Right, so now let's see, I'm going to press on this YouTube and I hope that it works. Can you hear and see that, Nikki?
We can, Kim.
We can, yes. HQIP hosts a service user network which was originally established 2 years after HQIP started in 2010. Recently, we changed how we engage with our service user network and we opened up how people can sign up and join the network. We communicate through newsletters and through emails. For this project, we put out an advert on our Sun newsletter and invited people to apply to join our project team for our HDR UK funded project. We received 15 expressions of interest and interviewed 5 people and were able to find 3 really enthusiastic, bright people to join our project team.
I'm Yvonne Sylov. I'm an Associate Director at HQIP and I'm a member of our Data Access Request Group, which is a committee where we look at applications to reuse the national data sets that we commission. So getting that committee functioning has been very important to us and we do a very good job, but to date we have never had any public members, and this is an ambition we've held for a long time.
We are really lucky that all the outputs we produced were done in co-production with our public members on our team, and this worked really well, and I think it was a really successful part of our project. Another element of the funding was used to try and make our kind of public image of our data access processes stronger. So that was mainly focused around our web pages, which when we reviewed them, we felt that the language and the accessibility of them was fairly targeted at a research audience rather than a public audience. So another one of our objectives was to try and improve the accessibility to a public audience.
Everybody created a really great project team where it was really comfortable to work, where we could all speak openly and easily, and we all worked together as a project team at every point in regular team meetings. What worked well in the project was a genuinely collaborative approach, working all together as a group.
I think what really characterised this process was the focus and drive of everyone and sheer commitment of everyone involved in setting up the PPI, and that we would draw on best practice from elsewhere, what each of us had learned from PPI elsewhere in data access.
One thing I particularly enjoyed is partnership meetings with the project teams. Everyone was welcoming and looking forward to my views and experiences, both as a patient or as a family carer or as a member of the public. I was delighted to see that my ideas and suggestions was appreciated and used to inform the outcomes of the initiative.
I'm really proud to be here with the team and presenting the work of bringing patients into our data access request group and how that group is really forging the way forward and including patients and service users in how their data is to be used going forward. And I think that's a real exemplar of how HQIP are co-producing a lot of our work with the patients and public.
Okay. I really hope that worked for everyone. If not, I think Matty's going to be sharing a link onto the chat. So hopefully you got the gist, but I just want to say a big thank you to Matty Smith, our Senior Comms Officer, who made that. Claudia Snudden, the project lead who you saw there on the video, she designed this poster, which we presented at a showcase event in London a few weeks ago. And so most of the team joined us there. You saw Yvonne Sylov, one of our associate directors who was part of our team, Chris, the CEO, and Matty, who filmed us, but also our amazing Sun members, Wendy and Sarah. Mike wasn't available that day, but I'm glad we've got him on the video. So you've got the gist, I think, but just to say what that was all about, as commissioners of the NCPOP, we're custodians of data from across all those areas of healthcare that you saw in an earlier slide. So our data access request group, DARG, meets monthly to assess requests, but currently has no public representation. And we have wanted this. It's been a long-standing goal to develop and embed public representation and co-production in our data access request process. So when we saw that Health Data Research UK opportunity, we went for it. So we wanted to embed public representation with the DARG, review best practice, co-design new features to web pages, and develop a sustainable model for the long-term inclusion of public members within the group. But to do this properly, we knew we had to co-produce this work. So that's why we recruited some members to actually sit on the project team, meeting fortnightly, whilst also meeting with other public members on similar groups in other organisations. And also they were involved in co-drafting text for the outputs. And these were the outputs. So we had the costed business case for our executive leadership team that we wanted to show them. We developed a process for recruitment, and then we updated the terms of reference for the group and also the web page. And then we presented all the outputs to our ELT, who approved us to move forward on the recruitment. Wendy, are you there? Do you want to talk a little bit about how we work together?
Yeah, of course. Hi, my name is Wendy Davis. I'm a cardiac and stroke patient and joined the network probably about a year ago now. And this has been such an exciting project to work on because I've worked on various bits of patient involvement with the British Heart Foundation and lots of independent projects. And often you join those projects at the end of it and ask for your opinion once everything's already been decided, and almost like a sign-off stamp. And this was completely different because we all started at the beginning. There was equal members from HQIP and then Sun, and it was a really collaborative process, working all together, really shared decision making along the way, learning various aspects as well of how DARG works, sitting in on a DARG meeting, and finding a really bespoke design that worked for DARG at the end result. And it was just such an interesting project to work on as well, because every member of the project team really brought a different element to it. So you had some people who are clinicians, Kim, who's a patient expert and a huge wealth of knowledge, and then Sarah and Mike as well, all had very different patient perspectives as a carer, of various knowledge of other groups they've been on. And then we also interviewed various experts along the way as well, disability champions, people who've also done data access request groups, and really took the best of every element along the way and then made the decisions together. And I'm really, really proud of what's been achieved.
Oh, brilliant. Thank you so much, Wendy. Mike and Sarah, if you're there, do speak up. Otherwise, I'll move on. But thank you, Wendy. And I think it's a really good point what Wendy says about how we were all learning together. I hadn't sat on DARG before. I didn't know anything about it. But also about co-production and about recruitment as we drafted application forms and shortlist criteria. And we had to do some real thinking about ensuring everyone on the project were equal participants. So what do we need to do differently to make that work? What technical information would team members need? How should we pace meetings appropriately? And how could we create a welcoming environment and encourage views to be freely expressed? We also made sure we were listening properly and asking questions so we understood each other's views and that each view was explored and discussed. And it was also important to recognise that public members may need extra support and encouragement to take on certain tasks, such as writing or editing something an expert has written. But it was just a great opportunity to see whether the ideas would have value outside of this project. What can we learn about future co-production? And I think our public members taught us a lot about the practicalities of truly achieving empowerment and diversity. So what's next? Well, we are currently advertising to the Sun. There's a deadline for the applications is next week, and we've got a healthy number of applications so far. Sarah Markham will be joining me on the interview panel with Desi Stajkowska, our IG lead. And once we have offered the roles, the 3 public members will receive training. They'll be supported by me in the first instance, but we will set up buddies from the DARG, so one for each public member to provide support before and after meetings and to make sure they are feeling heard and for any questions they may have. And obviously we'll monitor how it's working with each public member and with other members of the DARG. And I'm sure we'll be making changes, improving policies and processes over time and as needed. So this project was a 3-month project, but it's obviously having this long-term impact, and the whole team felt it was just, we all really enjoyed it. And it's given us real insights on the benefits of bringing public members onto project delivery teams. So whilst we have been involving people in communities in many areas of HQIP work, I mean, especially me, it's my job and I've been doing it for years, it was the first time we really had some members actually join the project team in this way, and we'll definitely be doing it again. So thank you to everyone, all the team, especially Mike, Sarah, and you, Wendy. Thanks for that, and thank you for listening. Oh, stop sharing.
Would you like us to put the next set of slides? Oh, fantastic. We'll hand over. Keep you going then. Sorry. I was just checking, Kim.
Do you want me to keep going? Can I share, if that's okay, please? I think that's Amanda's sharing. Do you mind if I share? Sorry.
Yeah, thanks, Kim.
Okay, you want me to go straight onto it then?
Oh, yes, please. I think we're waiting.
Okay. Okay, sorry. Let me do it again. Okay, so you can all see this then. Let me go straight into it. Sorry about that. Okay, so on to the most important part of today. We're here to talk about the audit heroes for this really important category. And I was absolutely thrilled this year about the amount of submissions we received. And the judges joining me were Jeanette Mills from NQI CAN and Sandy Woods and Simone Collicutt from Our Sun. And I think Sandy's going to say a few words a bit later. So the winners, with such good submissions, we really struggled to pick just one winner. So in fact, we've got 3 projects to be highly commended for their work, and they are listed here.
Kim, can we interrupt
Yes.
you? Sorry, we can't see your slides, I don't think.
I was waiting to see if you were about to pop them up, Kim, after you spoke, but yeah, we're not seeing your slides at the moment.
Oh God. Right.
Don't worry, just refresh it. They'll pop up. If not, we can get Amanda to share.
Right. Can you see these?
We can
now see them.
Oh, I'm so sorry. So I just keep this slide here for a minute because you can all see the shortlisted entries. And as I was saying, I'm so sorry. As I was saying, we couldn't pick just one. So we've got 3 highly commended. They're listed here, but I'm just going to move on to this slide because I've got some information about them. So from Northumbria, we've got Sandra Willis for an innovative project developing a website with service user consultation that is really beneficial for their patients. We also have Royal Marsden, a high priority area of care in which they engaged over 200 patients to create informational screens to highlight services. And I know Diana King, who was the project lead and a member of the Patient and Carer Advisory Group, is here today. And then NHS Benchmarking, the team that provides the national audit of care at the end of life, for collaborating with a patient panel to improve the quality survey and to improve the audit's improvement goals. And I think Jess is here today. So congratulations to all 3 of you for your highly commended win. But now on to the winners. So congratulations to Northampton General Hospital NHS Trust and Norfolk and Suffolk NHS Foundation Trust. These 2 amazing projects are the winners of this year. So congratulations. Just to say, Gemma Harris, the judges loved this submission as they engaged service users and carers throughout the project, with service users joining the project team to develop principles in involving people in quality improvement. So we'll hear from Gemma soon. And also Rebecca Goadsby, the judges loved this entry for their innovative approach to hear from service users and carers to improve their service, including publishing a report with clear actions. And I'll let Rebecca share more about that project. But before we hear from the winners, I think Sandy, my fellow judge, would like to say a few words.
Thank you very much. My name is Sandy Woods and I'm a member of the Service User Network, and I was really pleased to be part of the judging panel for the patient and public involvement. I'd like to say a big congratulations to the winners and commend the runners-up, but really to everyone who submitted their work, which again, as Kim has said, it took some time to go through because there were really good applications and they really demonstrated the engagement and commitment to experts by experience. And has already been said earlier, you know, the importance of co-production, and we were really looking for that being at every stage, so not just at the end when someone just reviews and says what do you think, but at every stage from the initial design through to all stages through to evaluation and action as well. What we were also really pleased to see was how there was engagement and partnership with all the different age groups as well. And so it was really, really good to see the work co-designed and co-led by young people, parents, carers, youth groups, champions, patient advice and liaison service, steering groups and ambassadors. So it really represented the real effort to outreach and engage people. We're really also pleased to see the range of methods being used as well to facilitate that public and patient engagement. And that included both face-to-face and online events. There were surveys, there were focus groups, there were visual and practical activities, and outreach into communities as well, not just expecting people to come in. And so we really thought about what had been included in there, and it was really that true co-production requires trust and respect and openness, and those are some of the things I know have been shared already. And really the valuing of the knowledge and skills the experts by experience bring to each stage of the process. And those were just some of the things that we looked at, and whether those were shared within the applications. And there was it was really just very, very encouraging, and really that drive for service improvement and quality of care. So thank you not only to those who received the awards and the commended, but to everyone who put in their applications as well. Thank you.
We've got Gemma joining now, Vicky.
Yeah, I'm here, Kim. Hi.
Hi, Gemma. Over to you.
Okay, so if you're happy, I've got a slide deck that I'll share, so I'll do that now. Oh, we've got that there. Okay. Let me just share that. Here we go. Okay. Can everybody see that okay? Has that started? There we go. I think that should have done it.
Yeah.
Yep, fabulous. Okay, so just a big thank you for having me here, and good afternoon to everybody. So my name is Gemma Harris, and I would like to introduce you to a quality improvement project which aims to increase lived experience involvement in quality improvement projects at the Norfolk and Suffolk Foundation Trust. At NSFT, we use the model for improvement as a methodology to support improvement work. Now, the model asks 3 questions to help define the quality issue, create a family of measures to ascertain the baseline of the current system, and to identify when change is statistically visible, and develop change ideas through a range of techniques, tools, and creative thinking. Now, the last step, which is the doing step kind of phase, is when the project teams start to test out their ideas using a plan, do, study, act cycle to test their impact as to whether the change ideas are supporting the improvement of the quality issue, or if they need to adapt and retest before sustainable change is detected. In early 2022, a quality issue was identified that started to explore why, of the active QI projects recorded, the involvement of people with lived experience was commonly not evidenced, and participation was a measure that was not routinely captured. After the quality issue had been identified, baseline data started to be collected and identified that less than half, only 43% of active quality improvement projects had some form of lived experience involvement. Now, to enable the project team to capture data, we identified and counted projects with big and little involvement. Now, little involvement is where there is evidence that service users and carers' feedback of the existing system had been captured and reviewed, and that they had been communicated with and invited to participate with an improvement piece of work that had just begun. We also completed a count of quality improvement projects where big involvement had been evidenced. So, for example, there were service users, carers and family members who had been supported to join a project team and or were facilitating the testing of change ideas. So we've got that real kind of co-produced piece of work happening in our projects. A project team was established using a stakeholder map, and the opportunity to be part of the project was advertised via internal communications, social media, and internal network groups to people who would have the motivation and drive to make change, as well as with those who were most impacted by the quality issue, that being our service users, carers, their families, and supporters. The project team consisted of members of the QI team, people participation coordinators, carer lead, peer support worker, carer, and 2 service users, and we all met on a fortnightly basis. Now, the project team worked together to establish a SMART aim for this project. And our SMART aim was to increase the percentage of quality improvement projects with service user and carer involvement, our big and little I, from an average of 43% in June 2022 to 65% by April 2023. To enable the project team to detect any improvements and to see if the SMART aim was on the way to being achieved, a family of measures were agreed. An example is the outcome measure, which was populated with data from an electronic platform called LifeQI, and that recorded and detailed projects where people with lived experience, big and little I, had been invited, engaged and consulted with to share their experiences, their feedback and ideas, and individual quality improvement projects that were running across Norfolk and Suffolk. Now, the project team, we used a statistical process control chart to map the data, and in this case, we used a percentage chart. Now, this chart really helped the team to identify when there were shifts in the system and provide a narrative based on the changes that were being tested that identified a shift in data being captured to see if we were meeting our aim. The project team utilised the nominal group technique to suggest changes and agree on the first change ideas to plan to test. And some of the change ideas included designing a co-produced course to support service users and carers with quality improvement methodology, creating leaflets to identify areas to participate across the Norfolk and Suffolk Foundation Trust, and reviewing the QI team's own internal processes in supporting new projects to involve people with lived experience. The project team tested out 3 change ideas using plan, do, study, act cycles to see the impact that they were having on the SMART aim. And one of them being inviting the QI People Participation Coordinator, namely me, to join all new quality improvement project proposal meetings to begin to explore the opportunities for participation from those with lived experience of the quality issue right at those early stages of an improvement piece. Over a period of 12 months, the project team met their aim of reaching 65% of active quality improvement projects having lived experience involvement in the planning and progression of projects. But the work doesn't stop there, and through a period of monitoring and adapting systems, the QI team have been able to establish a new average of 89% of projects involving people with lived experience in improvement work. Now, some of the changes the team have continued to test can be seen in the slide. So, for instance, we've created new bespoke training packages for our staff to help them really understand how participation and involvement can help them in their improvement work. And we've created new resources as well to help support participation. Now, this project was a truly collaborative approach and a huge success, and it really demonstrates how mutual and reciprocal working can have huge positive outcomes on improvement work. So thank you to the QI team and the experts by experience who shared their feedback on their experiences of participating in this project. And some of that experience you can see on the screen there. So just a really big thank you to everyone that was involved in the project. So yeah, that's a whistle-stop tour. So thank you everybody for taking the time to come and listen about our project. We had such a great time, really having those conversations with people and having the opportunity to have that lived experience right in the room together made such a big difference. So thank you. So any questions from anybody? I'll just stop. Let me just stop sharing now. There we go.
Lovely. Thank you, Gemma. Can see, John, you've got your hand up. Do you want to take yourself off mute?
Yes, thanks. Just a quickie. I thought this was really good. I love the way you did the measurements and got very specific. One question though, one of the big challenges we have in Stockholm is involving minority groups, especially people who don't have good command of Swedish or even English. And often they're the people we most need to involve, especially in mental health and other areas. Have you got any tips or reflections on that? I know it's a bit unfair because this is mostly a celebratory and recognition thing, but I would be very interested in your thoughts on that.
So, I mean, I think for us, we're really lucky that we have several kind of network groups within the Norfolk and Suffolk Foundation Trust. And so we've got, you know, a real pool of experience of working with different minority groups. And for me, it's about how I communicated with my counterparts who worked in specific localities and how we can kind of tailor how we reach out to people and what that looks like for, you know, these people that work in those networks who work in those other areas of the trust, they're the experts there. And so for me, it's a little bit of that kind of stakeholder mapping. You know, I kind of find out who's going to be most impacted by this and actually who are the experts in the room, who are the experts in the trust that can support me to make sure that I do reach out to a lot of these different populations and communities.
We have found social workers quite useful to zone us into communities, and especially the imams and faith-based leaders and going to there. But I know it does take time and you have to reach out and make a very great effort. So thank you.
Absolutely. And it's about building trust with those different communities as well, and longevity as well. It can't just be, I pop in for a little bit, thanks very much. You know, it has to be, you know, a dedicated time from you as well to show people that you actually, you know, want to hear from them and you want to involve people. So
that's so true about building trust and the networks, but in a sense that's really should be seen as another benefit of this work. In fact, it may be a greater benefit in terms of that trust building, relationship building that goes beyond these particular approaches.
Oh, is that on? Is John still there?
Do you mind if I also just say a few words about that? I think you answered that perfectly, Gemma, but it is absolutely about that relationship and understanding what your limitations as an organisation might be, and actually go to smaller charities, those smaller organisations who have already built those relationships. So let's go and talk to them and then work with them to go to those communities, rather thinking that you can access people in the way that we're speaking and that NHS speak. I think it's really relationships with communities and community leaders. Thank you. It's a good question.
Okay, is there anyone else? I think there might be a few in the chat, but I'm just mindful of time. So I think we were going to collate some questions. So I'm really happy to kind of get back to people who might have popped some questions in the chat if everyone would be happy for me to do that.
That would be great. Thanks, Gemma. That would be brilliant. Thank you. Okay. So I think if we move the slides on then, Amanda, then we'll thank you so much, Gemma. We'll move on to the next slide and we'll ask Becca if she can now present.
Hi, thank you. And thank you. I feel really honoured to be here even talking about this work that I've been doing. So yeah, thank you as well for having me. Next slide, please. So this definitely was not a solo project. And actually, I was just looking back through my slides earlier and I thought I've actually missed out probably some of the most important people on this list. And that is actually the experts by experience, people living with dementia and their carers and families that have supported me with this work. So that's a little my bad there. They should definitely be on this first slide. But before we got to that point of where we were able to engage people living with dementia and their families in this work, these were the teams that were helping me behind the scenes, and I could not have done any of the work without every one of these teams, from having the senior leadership support to all of these other services. Next slide, please. So as part of the National Audit for Dementia, we have to collect feedback from people living with dementia and their families and carers who have come into the acute general hospital in the local area. And this is a really difficult group of people to reach out because sometimes the information isn't always accessible to people living with dementia, and they're not always able to sort of get involved and have their voice heard regularly through these types of platforms. So we kind of wanted to have a really targeted approach. So we had a volunteer, her name was Alina. We have this scheme called Volunteer to Career, and she's actually gone off now to work in the public sector, so I miss her very much, but we have re-recruited. But she went out across the hospital and met and sat with people living with dementia to support them to be able to give them their feedback into this work. I think overall she collected between 60 and 70 feedbacks from people living with dementia, which was amazing. And that was sort of across the year, really. And then your typical way, right, to get people involved and hear about, we did the screensavers, we did the handing out the leaflets, but we found that the targeted approach really did work well for us. Next slide, please. So we wanted to get a better understanding of what some of the problems were. I think sometimes we get feedback in so many different ways. You know, we get it through the complaints process. I personally, as the dementia nurse for the hospital, was hearing experiences firsthand from people through our reports, through our clinical auditing, such as the report that we get through the National Audit of Dementia. And it really felt that we were getting all this information, and I kind of was a bit like, whoa, we've got all of this information, and what now? What do we do with all of this? And actually, how do we really understand what some of our problems are? So we decided to run a series of listening events across 2023. We had 3 listening events in total. And there was a lot of work that went into getting these set up. 2 of them were virtual and 1 was in person. The in-person listening event, we risk assessed, we thought really carefully about the location. We thought about, actually, we need a space. So we ensured that there was carers there to look after people with dementia if they needed any support. So the carers that were looking after them could have the time to come and talk to us. So we really kind of thought about every sort of element, I guess, in ensuring that we could sort of hear firsthand information. And what we did was sent these posters out to every single GP in our locality, and we asked the GPs, please put this in your waiting rooms, because we thought, actually, if you've been in hospital, the likelihood of going to your GP within 12 months is quite likely. So actually, let's target the waiting rooms in GP surgeries. And that was what we did. Next slide, please. So the actual event, so we had 1 person who was living with dementia that was involved, and we had 9 carers and relatives over the event. We had funding for the event through our local charity, Northamptonshire Healthcare Charity. We have a Do It for Dementia fund, and we wrote to them to get the funding for the room hire, at the lunch that was provided, because everybody likes a lunch. That was also helpful to have.
That's irrelevant.
But sorry, I just broke up then. So yeah, next slide, please. Oh, and there's Chris and Jason on in the picture, who is from our patient experience team, who have supported me endlessly with this project. Next slide, please. This is the not so easy read. Every time I look at this, actually, I get really emotional. I find it a bit like airing your dirty laundry. And actually, this is the reality of what it's like for people living with dementia and their carers when they're coming into acute hospitals. So what I did was pull out all the information from the listening events, from the feedback forms that we received, from complaints, from governance, from internal incident reporting. Any way that I was hearing about problems, I kind of wanted to centralise it. And split it into categories. So this is what we did. So we've got the first aim, which is all around communication, the second aim, which is around patient care, and then the third aim, which is around sort of our processes and how we do things. And then I kind of, and for those who are on the call that know me personally as well, knew how difficult I've struggled to do this. It really hit hard emotionally, because I think for me it was the accepting that we don't always get it right. And I think that's a difficult thing to do. It's difficult to accept that we don't always get things right. And I think actually recognising that from a personal journey was something that needed to be done to push this work further. So what we did was sent this out to all the participants and basically said, have we heard you correctly? We just asked, have we heard you correctly? And then followed up with, would you like to support us in trying to improve some of these things? Which took courage. And I remember having a conversation with the senior nurse, our chief nurse at the time, being like, are you sure that's what we want to do? And I was so excited that I had that senior support with this work. Next slide, please. And so that created the Dementia Focus Group. So we heard back from the people, and absolutely they said, yes, we would love to support you, Rebecca. We'd love to support you with this work. So we created it. It's a space purely for experts by experience, so either living with dementia or their families or carers supporting them. We had our first meeting in January. We've come up with our action. So we're focusing on 3 actions at a time, and we're reviewing them 3 monthly, and we're feeding back to our senior leaders within the trust, really giving an opportunity so people with dementia could have a voice. It was so important to me, and looking at how I can get people involved with dementia in the work that we're doing, and continually getting feedback as part of the audit as well. I think there's a note there to say we've had 21 pieces of feedback since September. Next slide, please. So we've had 4 meetings so far. We've got 5 experts by experience involved. And if you're on the call today, thank you for joining. And every meeting we have, I get so excited by it. And I'm always so thankful for your time that you provide to give, as a member of the public, to support with this work. And this is our initial action plan. We've, like any audits, sometimes creates more audits, which this definitely did. So we've done we're now doing a handover audit. The carers have come in and observed handovers, look at how are we sharing information about people living dementia, what does dementia mean, how are we handing that over, doing TikTok videos, working with our comms teams. The participants of the group have written the scripts and have written what they think it's important for the staff to know about, and then looking at a process point of view, or looking at how we can just improve dementia care across the whole trust. For those who are dementia nurses, and I think the National Audit of Dementia has helped with this, it's bringing us together. It can be a bit of a lonely world sometimes. There's usually only one dementia nurse in the trust in acute hospitals. I am the only dementia nurse in this hospital, and it's very similar across the UK for us to be sort of lone working. So the audit has really given us an opportunity to work together. So that's and to get our voice heard. So I feel very honoured for you to be able to have listened to me today, to hear about the work that we've been doing. Next slide. And so thank you for listening. I have dropped my email there for if anybody did want to ask me any questions if we don't have time today. And thank you to the Royal College of Psychiatrists and the audit team for nominating me as well. Thank you.
Oh, thank you, Becca. That was Absolutely great, and there's lots and lots of comments in the chat, so hopefully you'll have a chance to scroll back up now that you've finished your slides. But has anybody got any questions for Becca? Not seeing any raised hands at the moment. There were some comments in some really nice comments in the chat, Becca, and I think I'm just scrolling back up because I think John put a question in around what you learnt about needed out of hospital support for carers. They perhaps don't do that so well in Sweden with standard packages, and especially for the most in need minorities who are working and with childcare and maybe the only income earners. Any thoughts? Not sure if Kim might have anything to add there as well.
Let me just read the question.
What did you learn about needed out of hospital support for carers?
For people with dementia and families, I think it's there's lots of work around Carers UK, and we've done a lot of work, and I think we understand that it is a group of people that do really struggle in many ways, and they definitely need a bigger voice. They definitely need more support, and I think third sectors are really important with that. You know, like locally, we've got Northamptonshire Carers. They do amazing support for our carers, and a lot of that doesn't come through health funded services. A lot of that is sort of the third sector. So I think, and they're key, is what I would say, to give that support to carers.
I agree. I think it's absolutely the charities that are supporting the people that are most in need and most disadvantaged. But what we're trying to do, at least, you know, within the NCAAW, is to at least try and collect that information. Let's collect that data, learn about where there are these gaps and where there are these needs, so we can then do something about it.
Brilliant. Thank you so much. I think we were going to swiftly move you on to the evaluation, Marina. If you can help us out here and pop the link into the chat. And Amanda, if we could move on to the next slide, that should give us the details on the evaluation. And I'm going, whilst Marina's setting that up with you all, I'm just going to set you a few challenges to take away, mindful of time. We've obviously heard from Kim and the Sun members, and then obviously Gemma and Becca have shared their winning projects as well. And obviously, as you'll have seen in the chat, there were a lot more submissions this year, a lot more shortlisted as well. And I know HWIP are going to share some of the case studies on their website, so please do head on over and have a look at those once they're available. But thinking about what we've just discussed and what we've just shared, then I suppose it's thinking about what we're now going to do with that and take back to our own organisations to see what we can do to strengthen how we can get the patients and the public and our service users involved. And I know there was a comment in the chat here, really, to think about they are all people within their own rights, and their voice is so valuable in the way that we're shaping health and care. So it's thinking about, in terms of clinical audit now, how we can actively encourage that engagement through our patient feedback and our surveys, as you'll have seen happened here within our winning examples, linking in with the groups that currently exist in your Health Watch, and then thinking about how we communicating those outputs of those clinical audits back to patients, public service users in terms of what we found. So it's about putting that information across in the right format and the right language so that we're actively keeping them involved in what we're finding and what we're taking forward. And then from the outcomes and our improvements out of those, what matters to the people that are using our services in terms of what we focus on first and foremost. And let's get everybody involved in measuring that impact to make sure that we're looking at it from everybody's perspective. So we mentioned yesterday the words bold and ambitious, so I think we need to keep those going as we go through a week, really, and really start to push ourselves forward to be a little bit more effective in the way that we are engaging within our improvement work. So Marina's popped that link there in the chat, so hopefully you've clicked on it and you're completing that for us, so that we can actually utilise your feedback here. Don't forget to click on the links in the chat to join the Futures web pages if you're not yet a part of those workspaces. But very rich valuable information that's been shared here today, and obviously your comments and your questions that are in the chat as well from our attendees. So I think it's a thank you to Kim and our Sun members, and thank you to Gemma and Becca for sharing your projects, and for everybody that's added to the chat and participated and will continue to, and your feedback in the survey. I think this is about us all networking and collaborating together really, and we're giving it a go. We're working out what works and where we need to make things better, but we're learning from each other so that we can actually get that more wider spread and adoption of best practice. So I think we've got another slide that I think we could move on to, Amanda, just to share with you that tomorrow is Wednesday, and as we mentioned at the start, we've got Dr. Charlotte Richardson and Danny Keenan joining us tomorrow for health inequalities. So do, if you can, join us. The recordings and the slide packs will be made available on the HQIP website and on our NQI Future and NHS workspace on the Futures platform as well for you to access. And we'll obviously hear from the winner of the Clinical Audit Hero for Health Inequalities tomorrow. So thank you so much for joining us. Hope you have a good afternoon, and we look forward to seeing you tomorrow.
Thank you.